Hi, my name is David Lin. I'm a family medicine physician at Valley Medical Center. I chose family medicine because family medicine doctors had a pivotal role in my upbringing. As I was growing up, I saw them take care of not just me, but my family members and my friends. And in that way, they were not just caregivers for me, they were role models and community leaders and kind of like my mentors. I think that part of the beauty about primary care is that I think we naturally are drawn towards everything. I can never stop myself from learning, from improving myself, and in that way, everything is interesting to me. I have a higher interest in addiction medicine. For many patients, it can be a validating experience to have a primary care provider who's very passionate about addiction medicine. My favorite part of the job is getting to work with all kinds of specialists, all types of patients from every kind of background. We're really fortunate to practice in an area where there's a lot of cultural, geographic, socioeconomic diversity, and I think that that allows us to really be versatile and take care of people no matter what background they come in from, and I think that is something I really value. What I really appreciate about Valley Medical Center is that I really enjoy working with every member of my care team. When I chose to stay here after residency, I had several specialists reach out and say that they were happy I stayed and welcomed me back. Even my team here in clinic, we all share the same vision for patient care. We all are on the same page, and their passion is contagious, and I can't imagine myself practicing anywhere else. So outside of work, you can usually find me playing tennis or hiking with my dog. One of my favorite hobbies is collecting board games. I always find that there's a board game for everyone, and I always like helping people find the board game that they can share with their family members and friends. I think that in primary care especially, it's very important to involve family when you can in a patient's care. Family provide a kind of a second opinion on what a patient's going through that you can't get from the chart, and I think that really helps contextualize a lot of what they're going through. And there may be things that patients aren't willing to bring up or don't feel comfortable bringing up that maybe they are more comfortable talking about with a family member present as well. My philosophy for caring for patients is that I really want to treat patients the way that I would want to be treated in their shoes, and I think the last part of that is very important. Because if I were a patient, my biggest concern getting to my appointment would be, if my car breaks down or if I have a flat tire along the way. For some patients, they might be concerned about, whether they can afford their medications, whether they can afford to or whether they even have a ride to get into work. And I think that having that empathy and using that, applying that to your practice is really pivotal. If you care about your patients, it really pushes you if you care about your patients and if you empathize with your patients, it really pushes you to go that extra mile, to stay late, to answer all the questions, to really make sure what you're doing is what's best for them.